confident in what you're doing. When we're about communicating with older patients, you want to identify yourself. Once again, you want to be aware of how you present yourself. You want to look directly at your patient and speak slowly and distinctly. You always want to explain what you're going to do before you do it. Don't just reach over and do something before the patient knows. You may startle them, you may scare them. Always take time to explain what you're doing before you do it. And always listen to the answer that the patient gives you. And above all else, always, always, always show respect for that patient. You respect them, they'll respect you. And do not talk about the patient in front of him or her. And a lot of times when you communicate with the older patients, you have to be patient. It may take them a little bit of time to get the correct answer to you or to think about, what the answer is they're given. So be patient with them. A lot of times with older patients, they often do not feel much pain because as they get older, their nerve receptors do not work near as good as they do when we're younger. So they may not feel the pain, the way we think they should. We may see stuff on a patient that in our eyes, that they should be in extreme pain, but they may not be exhibiting pain like we think they should. They may not be fully aware of important changes in their body systems. And you must be especially vigilant for objective changes. When possible, give patients time to pack a few personal items before leaving for the hospital. And always try to locate hearing aids, glasses, and dentures before you leave. A lot of times, talking about communicating with children, a lot of times emergency situations are frightening and appears the most obvious and severe in children. A lot of times they're not used to strangers. They're to stay away from strangers. So, this is sometimes frightening to them. And they may be frightened by youths, and they're frightened by, a crowd of people scared of them. And, always let a child keep a blanket, a favorite toy, a doll, security blanket, anything that helps keep them calm. And if possible, have a family member or a friend nearby. And sometimes, if it's practical, let the parent or guardian hold a child during evaluation and treatment. A lot of times, as long as they're in the arms of that parent or their guardian or child care provider, they're more calm and more apt to tell you what you need to know. And when communicating with children, always be honest. Children can easily see through lies or deception. And tell the child at the time if something will hurt. If you're going to give them a little shot, tell them it's going to hurt a little bit, and prepare them for it. And respect the child's modesty. If you ever have to take a child's clothes off or cut clothes off or something to check something, always respect their modesty. Always speak in a professional, friendly way. Always maintain eye contact. And position yourself at the child's level. Do not tower over the child. Don't stand up and look down on them. If they're sitting on the floor, try to get down as close to the floor, if not in the floor, and when you talk to them.